Hey everyone, and thanks for tuning in and watching my update videos. For those of you who are new to my channel, my name is Dylan. I am from the Chicago South Suburbs, and in March of 2020, I underwent a rare and controversial surgery called pudendal nerve decompression surgery. Basically, in a nutshell, the surgery is the main nerve in the pelvis is the pudendal nerve, and the surgeon goes in to clear out any scar tissue from the nerve in order to try to alleviate the chronic pain that I was dealing with for about 7 years prior. It's a last resort type of surgery after many treatments for pelvic pain have been tried. There is some debate on whether or not the surgery is successful at all, or if there is really such a thing as pudendal nerve entrapment syndrome. So I went ahead and made the plunge in March of 2020 and went to Phoenix, Arizona to have surgery with Dr. Michael Hibner, who is very well known for this condition. And I am 9 months and 1 week post-op from the surgery. In October, I also underwent a stent placement of the iliac vein on the left side of me, which was another part to my medical journey. I'm going to try to stick to speaking about the pelvic pain and the pudendal nerve surgery that I underwent for this book. Come March, I will be 1 year post-op, and I'm going to be shifting my blog to speak about Ehlers-Danlos syndrome, which is another condition that I was diagnosed with. And basically at this point in the game, I don't really believe that the surgery has helped me in the way that I expected it would, although it's still early. They say that it can take anywhere up to 2 years to see relief from the surgery, and the relief happens in a short time period. It does not happen gradually. So that's kind of where I'm at with the nerve pain. I still experience stabbing, stinging, shooting nerve pain on the left side of my pelvis, all the way to the sacral nerve roots in the tailbone area. I'm doing physical therapy twice a week. And my physical therapists are pelvic specific PTs. However, they kind of have a whole body approach to treating people, and most of the work that they do is an external work, basically visceral work, kind of seeing where the tension is in your body and following that and helping out your body where it needs help. And sometimes they will do internal work on me to assess my muscles, but I don't believe for me that my muscles are a primary issue. I believe that my issue is musculoskeletal. Basically, I believe that I have, due to my Ehlers-Danlos syndrome, I have very lax and weak ligaments that made it easier for some of my peripheral nerves to become entrapped. This is just my case. Everybody is different. Most people that have pudendal neuralgia have muscular involvement in some way, shape, or form. I definitely have tight pelvic floor muscles. I underwent a lot of treatments prior to having surgery. I did CT-guided nerve blocks. I did nerve blocks in different areas of the body. I was doing physical therapy for many years prior. Diet changes, lifestyle changes, acupuncture, chiropractic. I had seen a wide variety of specialists. I probably have seen over 50 doctors in 7 years and for different things to rule things out prior to having surgery. I will say that if you're going to go through with pudendal nerve decompression surgery, do your research. Research what other things could possibly be contributing to the nerve pain. Research the surgeons, research the methods. There are different methods to PNE surgery. The most common one in the United States is the transgluteal approach. In Europe, they have other approaches, and in my opinion, they're better at treating PNE. They have the laparoscopic approach. However, there are downsides to different approaches. Some of the approaches that are less invasive don't necessarily see the entire nerve branch. Some of the approaches, the transgluteal approach specifically, is very invasive. It is the most invasive. However, it does get the most most area of the nerve. The body prioritizes healing in a variety of ways. First and foremost, it'll prioritize vascular or blood organs. So if there's an issue with the organ, the ligaments and the nerves are last on the totem pole to get healed in the body. So keep that in mind when you are considering surgery. And most people are going to ask you, if you're feeling better and blah, blah, blah. And it's going to be a long and grueling recovery for pudendal decompression surgery. I would give yourself at least 2 years to heal. Prior to having nerve surgery, I would go on disability, make sure you have some other form of income, because I can tell you that you will probably not be able to work a full-time job after the surgery. I'm thankful that I'm able to work remotely for work. So having a remote job is amazing. You can you can stand, lay down, alternate positions however you can. If anybody has any questions in regards to pudendal nerve decompression surgery, I'd be happy to answer anything. My medical journey is far from over. In fact, I believe it is just beginning now that I have more of a broad picture of what's wrong with me and why things are happening to me, whereas I didn't have those things prior to surgery. And unfortunately, it took a major surgery for me to learn even more about my condition, because I was so focused on my nerve issues that I ignored a lot of other symptoms that I was experiencing from childhood on. So thanks for watching my updates. I will talk to you guys in a week. Sorry for the late update, and I'll catch you later. Bye.